Welcome to this video. In this video, we're going to study inflammatory bowel disease, which for short is often abbreviated down to IBD. So let me begin by giving you a brief summary of what inflammatory bowel disease actually is, and then I'll give you an overview of the structure for the video, and then we'll actually commence. So, to begin with then, a brief summary of what inflammatory bowel disease actually is. So let's imagine that we have an individual who suffers from inflammatory bowel disease. What is this individual going to actually suffer with? Well, the name gives you a lot of clues. Inflammatory bowel disease. So firstly, let's just tackle this word bowel. What does that actually mean? So bowel is an old word for intestines. So the small intestine and the large intestine together, you can refer to them as the bowel. So this is going to be a disease of the intestines majorly. And inflammatory means that you're going to be getting inflammation occurring within the bowel. So inflammatory bowel disease is where you get inflammation occurring within the intestines. So let me just remind you of what inflammation is briefly, and we'll go into in much more detail later on when we go on to discuss the pathophysiology underlying inflammatory bowel disease, what inflammation is. But briefly, inflammation is something that can occur in any tissue within the body when there is a problem in that tissue. So if the tissue has been injured or if there is an infection occurring within the tissue, inflammation can occur there. And the point of inflammation is to bring in troops from the blood that can help deal with the problem in that tissue. So the troops that are present within the blood are proteins within the blood and also white blood cells within the blood, which for instance are very good at fighting infections. So, in the process of inflammation, you get an inflammatory exudate formed, which is fluid coming out of the bloodstream containing lots of proteins from the bloodstream, and you also get loads of white blood cells coming into that region of tissue. So that's what inflammation is, an exudate forming and white blood cells being recruited to that area, and it's because there is believed to be some sort of problem occurring in that tissue. The body believes that that tissue has got a big problem and needs help from the troops within the blood. So, in inflammatory bowel disease then, the sufferers get inflammation occurring within some portion of the intestines generally. Now, is inflammatory bowel disease a continuous thing? Does that inflammation come and then stay there forever as long as the person has the disease? The answer is no. Inflammatory bowel disease is an episodic disease. People who suffer from this disease get episodes of inflammation occurring within the intestine, and then they get periods where they don't have inflammation occurring within the intestine. So it's a disease that comes and goes, and we have a fancy term for diseases that come and go. We call them relapsing, remitting diseases. So you can describe inflammatory bowel disease as a relapsing, remitting disease. So this is the fancy term for a disease that comes, when it relapses, it comes, and then when it goes into remission, it goes away. So, to summarize what I've just told you, inflammatory bowel disease is a relapsing, remitting, or you could say episodic disease in which you get inflammation occurring within some portion of the intestines. Okay, so there's my brief summary of what inflammatory bowel disease is. Let me now give you an overview of the structure of the video. So we're going to start by going over the basics. I want to go over the two major different forms of inflammatory bowel disease and how they differ. I also want to go over the symptoms of inflammatory bowel disease. Then what we'll do is we'll begin our discussion of the pathophysiology underlying inflammatory bowel disease. And to do that, we're going to need a little bit of histology. So we'll go over the histology of the wall of the intestines. After we've done the histology, we'll go into the full story of the pathophysiology, and then finally we'll finish the video by going over the current drug treatment for inflammatory bowel disease, and we'll try and understand how some of these drugs actually work to treat the inflammatory bowel disease. Okay, so to begin with then, I want to go over the two different forms of inflammatory bowel disease and the symptoms of inflammatory bowel disease when you're actually in an episode of the inflammation occurring. So, firstly, the two different major forms of inflammatory bowel disease. So I'll write this down here. So I'm going to keep things simple. We're just going to discuss two forms of inflammatory bowel disease, which are by far the two major forms of inflammatory bowel disease. However, there are other forms of inflammatory bowel disease beyond these two. However, we're not going to discuss those. We're just going to do the biggies. So the two major forms of inflammatory bowel disease are Crohn's disease, which is often for short abbreviated down to CD, and also ulcerative colitis, which is for short often abbreviated down to UC. So CD and UC, those are the two major forms of inflammatory bowel disease by far. So, what I want to do is explain to you how these two different forms of inflammatory bowel disease differ from one another. Both of them conform to that initial summary that I've given you. Both of them are relapsing remitting diseases where you get episodic inflammation occurring within some portion of the bowel. However, they do differ from one another. And I want to firstly give you a little bit of insight into how they differ from one another. As we go through the video, as we discuss pathophysiology, I will show you in much more detail how these two diseases differ from one another. But I do want to initially say something to give you some intuition behind how these are different to one another. Firstly, before we do that, let me just give you some basic facts about their prevalence. So the prevalence of Crohn's disease is roughly 1 in 300 people, and the prevalence of ulcerative colitis, it affects roughly 1 in 400 people. So Crohn's is believed to be only slightly more prevalent than ulcerative colitis, but roughly they've got the same prevalence. Okay, so what is the difference between these two diseases? So, the first major difference is that they affect different parts of the intestine. So, Crohn's disease can actually affect the entire gastrointestinal tract, so not just the intestine. It usually affects the small intestine. The small intestine is the major place where Crohn's disease affects, but it can affect any portion of the gastrointestinal tract. Specifically, the portion of the small intestine that is most commonly affected in Crohn's disease is the ileum. And don't worry if you're not completely familiar with the anatomy of the different parts of the gastrointestinal tract, because I'll go over that in just a moment. Ulcerative colitis means inflammation of the colon. This is a disease which primarily affects the colon and also the rectum, so it doesn't affect other portions of the gastrointestinal tract. It affects the large intestine, also called the colon, and the rectum, but it doesn't go into the small intestine, and it certainly can't go any higher than the small intestine. So that's one of the first major differences between these two diseases, that the portions of the gastrointestinal tract that they can affect is different. So let me just go over the anatomy of the gastrointestinal tract, the different portions of the gastrointestinal tract, to make sure that everyone's comfortable with this, since we are discussing a disease that affects the gastrointestinal tract. So I'll begin by drawing on the esophagus here, which is, of course, part of the gastrointestinal tract. The gastrointestinal tract, by the way, is all the way down from where you put food in to all the way down to where things come out again. Okay, so here, this is the esophagus, which is, of course, the tube that connects the pharynx to the stomach, and I'm using the British English spelling of esophagus here, which has the silent E. If you prefer to use the American English spelling, just cross off that silent O. If you prefer to use the American English spelling, cross off the silent O and just have E as your first letter. Okay, so the esophagus is the first major portion of the gastrointestinal tract. Then, after the esophagus, we're then going to have the stomach, which I'll put in like so. Okay, so this is the stomach, and I'm going to bring my labels further away from the diagram because it'll leave space for me to put on the large intestine later on. Okay, so that's the stomach. Then, of course, we're going to go into the small intestine. Now, the small intestine is usually divided up into 3 separate sections. The first section is called the duodenum, the second section is called the jejunum, and the third section is called the ileum. So let me put these sections on. So, I'm just going to draw the entire small intestine first of all, and then I'll colour code in the different portions. So here we go. And now let me put on the other wall. So bringing this one round, all the way around, like so. Okay, so this is the entire small intestine. Let me now divide it up into the 3 separate sections. So the first section is the duodenum, which we'll colour code we'll have blue. So all of this section that I'm colouring the lumen in blue, all of this is the duodenum. Then the next section is the jejunum. So this bit in the middle, this is the jejunum. And I'll colour code that in I think we'll go for green. So all of this portion in the middle, this is the jejunum, like so. And then the final portion of the small intestine is called the ileum, or the ileum, depending on how you want to pronounce it. And I'll have this one coloured in red here. Now, the small intestine does follow this basic pattern. However, it's more complicated when you actually see it in real life. It looks far more complicated than this, and the reason it looks far more complicated is that along this basic course that I have shown you here, it folds over and over on itself like this. So imagine taking this tube and then making it much more convoluted. That's the way the small intestine actually runs, and that's how it ends up being so much longer than it would be if it was just straight the way I've drawn it. But it does follow this basic pattern of going round in this C shape if you're talking about the duodenum, and then coming round here, and then the jejunum having these 2 folds effectively here, and then the ileum coming back to the patient's right over here. But as I say, it's made much longer by the fact that it follows a much more convoluted path. Okay, so those are the 3 components of the small intestine, and I might just put this here. These 3 parts are the small intestine, and we could in fact call it the small bowel if we wanted to use our old word. So those are the small intestine. Okay, so after the small intestine, of course, we're going to go into the large intestine, and the first portion of the large intestine, straight after the ileum here, is going to be a portion called the cecum, which has the appendix coming off. So this little bit here, this is the appendix. So if you haven't had your appendix removed, your cecum will have this little bit here. Okay, so I'll label this over here. So this is the cecum, spelt like so, with the funny A, and then the bit coming off the cecum here, this is the appendix. Okay, so you have the cecum here, that's the first portion of the large intestine. Then we're going to have the major portion of the large intestine. We'll have the ascending colon, the transverse colon, and the descending colon. Now, this is going to be where the picture gets a little bit more complicated, because it's going to involve me drawing over the small intestine, because the colon actually moves over the small intestine. So, I'm sorry if this ends up ruining the picture of the small intestine. So, we come up here. So here is the ascending portion of the colon, or the ascending portion of the large intestine. So colon is just another name for large intestine. So this is the ascending colon, because of course it's going up here, and then it turns around at a right angle just below the liver, and then comes into the transverse colon that moves horizontally like so. So let's put here This is the transverse colon. And then again, it's going to turn at a right angle and then come back down. And I think I'd like to sort of try and bring it down to the side of the small intestine so I don't completely ruin my picture of the small intestine. So here. And this is the descending colon here. So we have the ascending colon first, going up to where the liver is, the transverse colon, and then the descending colon coming back down here. After the descending colon, you're then going to have a portion that leads into the rectum, which is called the sigmoid colon, that has a sort of S shape, hence it being called the sigmoid colon. But it's difficult to draw that, so I'll just draw it like so. So this portion here is called the sigmoid colon. So this bit is the sigmoid colon because of its S shape, and it sort of goes backwards to where the rectum would be, whilst the descending colon is much further forwards. And then, of course, we go into the rectum, and then, of course, you'll have the anus right at the bottom here. So this is the rectum here. Okay, so all the way from the cecum and the appendix, with the ascending colon, the transverse colon, the descending colon, the sigmoid colon, all of this is the large intestine. The rectum is considered separate from the large intestine. And you can also call the large intestine the large bowel, or you can just call it the colon. Okay, so there's the anatomy of the gastrointestinal tract, and I think I'll just actually put that title. This is the gastrointestinal tract, GIT for short. Okay, so why did I draw this? Because I wanted to show you the different parts that can be affected by these different types of inflammatory bowel disease. So we'll start with ulcerative colitis, because ulcerative colitis affects a smaller part of the gastrointestinal tract. Ulcerative colitis nearly always affects the rectum. So the rectum's nearly always affected in ulcerative colitis, and then it can work its way backwards from the rectum and affect all of the colons. So it can affect the sigmoid colon, the descending colon, the transverse colon, the ascending colon, and the cecum. All of this large bowel and the rectum can be affected by ulcerative colitis. So I'll just put this in here. So it can affect the large bowel and the rectum. Now, an important thing to say about ulcerative colitis, and one of the major ways in which it differs from Crohn's disease, is that the portion of intestine that it affects is a great big continuous lump. Now, what do I mean by that? What I mean is that you don't have a bit up here that is affected and a bit down here that is affected. You don't have patches of the intestine affected by ulcerative colitis. You have one great big continuous patch. So if it affects the rectum and it affects this bit up here, then all of the bit in between would have been affected as well. So you have only one great big continuous patch of intestine affected by ulcerative colitis. So the inflammation that occurs in ulcerative colitis occurs in these lower portions of the gastrointestinal tract, and it occurs in one great big continuous area of the intestinal wall, which is different to Crohn's disease. Crohn's disease affects patches. So let's now go on to Crohn's disease. So Crohn's disease can affect the entire gastrointestinal tract. So all of the gastrointestinal tract can be affected by Crohn's disease. So if you've got Crohn's disease, inflammatory bowel disease, you can get episodes of inflammation occurring in any portion of your gastrointestinal tract. However, the most common bit that is affected is the small intestine. In particular, the ileum portion of the small intestine is the most commonly affected portion. So I'll just put this in here. So the ileum is the bit that's affected most commonly in Crohn's disease. The other major difference between Crohn's disease and ulcerative colitis is that Crohn's disease occurs in patches with gaps in between them, whereas ulcerative colitis, as I said, it occurs in one great big patch. So in Crohn's disease, you can have a patch here that's affected, you can have a patch here that's affected, and then all of the bit in between might not be affected, which is different to what happens in ulcerative colitis. So the distribution of the disease is different between Crohn's disease and ulcerative colitis. Another major difference between Crohn's disease and ulcerative colitis, which I'll explain in much more detail later on when we come on to pathophysiology, is the type of inflammation that occurs. So what do I actually mean by this? So I gave you a brief discussion of inflammation earlier on when I was doing the summary of inflammatory bowel disease. I said that you get an inflammatory exudate formed and you also get loads of white blood cells coming into the tissue. Now, there are loads of different types of white blood cells that the body has, and therefore, depending on which types of white blood cells you use, you can get different forms of inflammation. So, here's the piece of information. In Crohn's disease and ulcerative colitis, different types of white blood cells are believed to be crucial in the inflammatory process, and therefore you get different types of inflammation. So I'll say that again. In Crohn's disease and ulcerative colitis, you have different types of inflammation, meaning that there are different types of white blood cells involved. And we'll explore that in so much more detail. You'll understand that properly by the time we have finished discussing the pathophysiology. Okay, so at this stage I will leave it at that as far as what the difference between Crohn's disease and ulcerative colitis is. So we've seen that the distribution of the disease is different, and we've also seen that the type of inflammation in Crohn's disease and ulcerative colitis is different. So the final bit of introductory stuff to do is to go over the symptoms of inflammatory bowel disease. So I'll just go down here and we'll discuss symptoms. So the symptoms of Crohn's disease and ulcerative colitis are actually reasonably similar because both of the diseases are fundamentally inflammatory bowel disease. They both involve inflammation occurring in episodes within some portion of the intestine. Now, of course, the symptoms that I'm about to give you are the symptoms of a relapse of inflammatory bowel disease. So I said that inflammatory bowel disease is an episodic disease. It's relapsing, remitting. You will only have the symptoms present when you're in a relapse, when you're in an episode, when the inflammation is actually present within some portion of the intestine. So these are the symptoms of a flare or an episode or a relapse of inflammatory bowel disease. So, symptom number 1 then is that during an episode of inflammatory bowel disease, you will get abdominal pain. Now, hopefully you can understand why this is. You have got inflammation occurring within some portion of the intestinal wall. When inflammation occurs in a tissue within the body, it leads to the activation of the pain neurons within that portion of the tissue. It makes them fire action potentials, and that gives you the sensation of pain. The intestinal wall has pain neurons within it, and therefore when you get inflammation occurring within the intestinal wall, it will lead to the activation of those pain neurons, and therefore you will get abdominal pain. So hopefully that symptom makes sense to you. Symptom number 2 of a flare of inflammatory bowel disease is that you can end up with diarrhea. And of course, diarrhea is when you've got too liquidy poo. And we'll discuss later on when we come on to the pathophysiology of inflammatory bowel disease the reasons that having inflammation occurring within a portion of the intestinal wall is going to lead to too much fluid present within the poo. However, I should add at this stage that as well as having diarrhea, you can also have blood within the diarrhea, and you can have mucus present within the diarrhea as well. So blood and mucus can also be present within the diarrhea in a flare-up of inflammatory bowel disease. Category number 3 of the symptoms of inflammatory bowel disease is the constitutional symptoms. Now let me just take a little bit of time to explain what I mean by constitutional symptoms. So if you want to give these their absolutely full name, you can call them the constitutional symptoms of inflammation. So these are the systemic symptoms, the global symptoms, the whole body symptoms of having inflammation occurring within some portion of the body. So these are symptoms that you get no matter where the inflammation is present. These two first ones, abdominal pain and diarrhea, these were symptoms that were present because the inflammation was present within the intestinal wall. They were local symptoms, if you liked. Whereas these are global symptoms. These are symptoms that will occur, and they would occur the same no matter where the inflammation was present. So, let me give you examples of constitutional symptoms. So, for instance, having a raised body temperature, a fever is an example of a constitutional symptom of inflammation. Another example is feeling tired and unwell. So, fatigue is the name for tiredness, and malaise is the name for the feeling of being unwell. You can also end up with muscle aches and also a headache. So I'll put these here so you can end up with muscle aches. And you can also end up with a headache, and the type of headache that you end up with is referred to as a tension headache. It's that bilateral headache that feels like squeezing, and it's usually worse in the temporal regions, the sides of the head. You can also call tension headaches tension type headaches if you want to give them their full name, so you can abbreviate it down to TTHs for short. Okay, so why do all of these symptoms occur? You might recognize these symptoms from, for instance, the symptoms of having flu. We've all had flu before, which is an infection by influenza viruses of the respiratory tract epithelium. And you get these sort of symptoms. You get a raised temperature, you feel really tired and unwell, and you just want to stay in bed. You get muscle aches in your arms and your legs, and you get a headache, a squeezing headache that's worse in the temporal regions but can extend into the frontal region and the occipital region of the head. Why do you get those symptoms? It is not that the virus, the influenza virus, has gone into your blood and is now affecting all of those tissues far, far away. Instead, it is that you've got inflammation occurring within the respiratory tract epithelium, and this secretes loads of mediators into the blood. So whenever you have inflammation occurring in any portion of tissue within the body, loads of molecules, signaling molecules, proteins and small molecules are released in that site that are inflammatory molecules and which cause the inflammatory response, and these end up going into the bloodstream and then causing whole body responses. They cause the brain to raise body temperature, they make the brain feel tired and unwell, they make pain occur within the muscles of your limbs and also sometimes in your back, and they make pain occur in the muscles of your head region, the muscles in your temporal region and the frontal region and the occipital region, to give rise to the headache. So it is not that the infectious agent is going into the blood and causing a systemic infection. Instead, it is that the inflammatory mediators are going into the blood and causing a systemic response. So these, if you like, are the systemic symptoms of inflammation. So whenever you get inflammation occurring anywhere within the body, you can get some of these symptoms. The more inflammation you have, the more of these symptoms that you will get, and the worse the symptoms will be. So we call these the constitutional, or you could call them the systemic or the global symptoms of inflammation occurring in some local portion of tissue. So when you have a flare-up of inflammatory bowel disease, of course you have inflammation occurring in that portion of the intestine. It will be releasing loads of inflammatory mediators into the blood, and therefore you can end up with these constitutional symptoms of inflammation from these mediators going all over the body and taking effect. Okay, so that is another major category of symptoms of inflammatory bowel disease flare-ups. And then number 4 that I'll put on here is that you can end up with weight loss. And the reason that you can end up with weight loss is mainly thought to be that when you've got inflammation occurring in a portion of the intestine, it can then lead to problems with absorption of nutrients, and therefore if you're not absorbing nutrients properly, that can lead to losing weight. So this is another major symptom of an inflammatory bowel disease flare-up. Okay, and these flare-ups can last from a few days to going on for months, so they can last for a long time. So we will have a break here, and in the next video we will go on to some background histology so that we can then discuss the pathophysiology underlying inflammatory bowel disease.